So here's our game plan. First, we'll get a really clear picture of what fluid in the lungs actually means. Then we'll dig into the causes. Some are heart-related, some aren't. After that, we'll cover the symptoms, how doctors figured this out, and finally, what you can do to lower your risk. Ready? Let's jump in. All right, first things first, what is pulmonary edema? Let's define it and clear up a couple of common mix-ups right off the bat. Okay, so in the simplest terms, pulmonary edema is when fluid builds up where it's not supposed to be, inside your lungs' tiny air sacs. And this is a huge problem because your lungs have one critical job, to get oxygen from the air into your blood. When fluid gets in the way, that whole process gets disrupted, leading to some really serious breathing problems. Now, here's where people often get confused. Is this the same as pneumonia? Well, no. With pneumonia, you also have fluid in the lungs, but that fluid is the result of an infection. It's kind of like a battleground full of germs and your body's immune cells. Pulmonary edema, on the other hand, is typically a thinner, watery fluid that's not caused by an infection. And there's one other key distinction to make. See, with pulmonary edema, the fluid is inside the lungs' air sacs, but with a condition called pleural effusion, the fluid builds up outside the lung, in the space between the lung and the chest wall. So think of it like this. One is a waterlogged sponge, the other is a sponge sitting in a puddle. Totally different things. Okay, so now that we know what it is and what it isn't, the big question is, why does it happen? Well, the causes usually fall into one of two major buckets: things related to your heart and, well, everything else. You can think of it as a pump problem versus a pipe problem. The heart-related causes, what doctors call cardiogenic, are the pump problem. If your heart isn't pumping blood forward effectively, like with congestive heart failure, pressure backs up into the lungs. It's literally like a traffic jam in your circulatory system, forcing fluid into those air sacs. The other causes, the non-cardiogenic ones, are more like leaky pipes. In this case, the blood vessels in the lungs themselves get damaged, maybe from an infection or an injury, and they start to leak fluid directly. Two very different pathways to the same dangerous situation. All right, let's get into what is maybe the most crucial part of this whole explainer, the warning signs. It's so important to understand that pulmonary edema can show up in two very different ways. It can hit you all of a sudden, that's called acute, or it can develop slowly over time, which is chronic. So on one side, you have the acute symptoms. This is a sudden, often terrifying experience. We're talking an extreme feeling of suffocation, like you're drowning. But on the other side, the chronic symptoms can be a lot more subtle, a lot sneakier. Maybe you notice you get winded more easily, or you need to prop yourself up with a bunch of pillows just to breathe comfortably at night. The big difference here is the speed and the severity of it all. I really want to pause here for a second, because if you take away just one thing today, this is it. Acute pulmonary edema is a life-threatening medical emergency. If you or anyone you know suddenly has these severe symptoms, you have to get emergency help right away. There is no waiting this out. So, if someone is experiencing these symptoms and they get to the hospital, what happens next? Let's quickly walk through how doctors diagnose this and what the immediate treatment looks like. So, the first thing a doctor is going to do is a physical exam. They'll use a stethoscope to listen to the lungs, and they're listening for a very specific sound, a crackling noise, which is a telltale sign of fluid. They'll also check your heart, look for any swelling, especially in your legs, and check your skin for a bluish color, which tells them your body isn't getting enough oxygen. Then, to really confirm what's going on, they'll use a few key tests. A chest X-ray is huge because it can actually show the fluid in the lungs. They'll clip a little device called a pulse oximeter on your finger to quickly check your oxygen levels. And tests like an EKG or an echocardiogram can help them see if the root of the problem is your heart. Now, all those tests help doctors figure out the why. But for you, at home, the single most important question is this: when do you need to act, and act fast? This right here, this is your emergency checklist. If you or someone you're with has extreme trouble breathing, is coughing up a pink, frothy liquid, or their skin starts to look gray or blue, do not wait. Don't second guess it. These are massive red flags. It's time to call 911 or get to an emergency room immediately. Okay, for our final section, let's shift gears and talk about something really empowering: prevention. Because while this condition is absolutely serious, there are things you can do to take control and really lower your risk. Really, prevention all comes back to managing your overall health, and especially your heart health. If you have a heart condition, taking your medication is, non-negotiable. A low-salt diet is a game changer because salt makes your body retain fluid. And it goes without saying, but not smoking is just huge for protecting your blood vessels. All of this, combined with staying at a healthy weight and seeing your doctor regularly, that's how you stay proactive. So we'll leave you with this final thought. Your body gives you signals all the time, and your breathing is one of the most important stories it tells. Don't ignore things like a new cough or worsening shortness of breath. Really listening to your body, that's your best defense. Thanks for joining us today.